Hi everyone, welcome to my channel. My name is Yode. I'm a medical student of 5 years in Tashkent State Medical University. Today we will talk about the fetal circulation. Fetal circulation is important, so every student should know mechanism and structures. So let's begin. Fetal circulation starts from placenta. This is a picture from first aid for USMLE Step 1 2026. This is a placenta. Within the placenta, this is the umbilicus of fetus. This is a fetal side. Between the placenta and umbilicus of fetus, located umbilical cord. This is the umbilical cord. Within the umbilical cord, there are 3 vessels. 2 vessels, umbilical arteries, 2 umbilical arteries, and single umbilical vein. Within the umbilical vein, highly oxygenated blood flows. Within the umbilical arteries, deoxygenated or venous blood flows. Placenta gives rise. Umbilical vein starts from placenta, then enter to the fetus through umbilicus. After entering the umbilical vein goes to the heifer. This is a heifer. Before entering the heifer, umbilical vein gives rise to the branch. Name of the branch is ductus venosus. Ductus venosus. Ductus venosus release the blood to inferior vena cava. This vessel is inferior vena cava. Inferior vena cava goes up and release the blood to right atrium of the heart. Right atrium. Within the right atrium and the left atrium, intra-atrial septum is located. This is an intra-atrial septum. Within the intra-atrial septum, second important shunt located, it's called foramen ovale. Foramen ovale provides the passage of the blood or blood flow from right atrium to left atrium. Blood from inferior vena cava released to right atrium, then through the foramen ovale goes to the left atrium. Blood from left atrium then continues release to left ventricle through the mitral valve. Between the left atrium and left ventricle located mitral valve. Then left ventricles release the blood to the aorta. From aorta starts systemic circulation. In the arch of aorta, 3 large branches. First branch is brachiocephalic, trunks brachiocephalicus, also known as innominate artery. Second is common carotid, left common carotid artery. Next is subclavian artery, left subclavian artery. Then the blood goes to the peripheral organs and others. We go back to the umbilical vein. The main part of umbilical vein drains the blood to portal vein, then goes to the heifer. From the heifer, 3 umbilical 3 hepatic vein drains blood to inferior vena cava. Inferior vena cava also release to right atrium. Not only inferior vena cava, we have a superior vena cava. Superior vena cava also drains the blood to right atrium. From the right atrium, blood passes to right ventricle. Between the right atrium and right ventricle, tricuspid valve is located. Through the tricuspid valve, blood passes. Then right ventricle releases the blood to pulmonary trunk. This is a pulmonary trunk. In the fetal period, lungs cannot work, so lungs cavity is filled with amniotic fluid. There is no oxygen here, so to the hypoxia, lungs responds by vasoconstriction. So in the lungs, pulmonary capillaries, vasoconstrictions can lead to increase pulmonary vascular resistance. Increase pulmonary vascular resistance can lead to pulmonary hypertension. In the fetal period, pulmonary artery pressure higher than aortic pressure. So we have a third shunt. Third shunt is ductus venosus. Ductus venosus here, located between pulmonary trunk and aorta. Blood goes from high arterial pressure to lower pressure. So in the fetal period, because of increasing of pulmonary pressure, blood from pulmonary pressure goes to release to aorta. Then so pulmonary lungs cannot receive any blood from pulmonary trunk. Then blood passes through the aorta, then gives nutrition and oxygen to the periphery. In the abdominal side, it divides to common carotid artery left and common carotid artery right. Also, common iliac arteries divided two parts: external iliac arteries and internal iliac arteries. From internal to internal iliac arteries, the branch gives rise to branches. This is the name of the branch: umbilical artery. Umbilical artery and umbilical artery goes to the umbilicus, then enters the umbilical cord. Within the umbilical arteries, blood content is venous, deoxygenated, goes to the placenta. So, in fetal circulation, three important shunts are: first is ductus venosus. Ductus venosus located between umbilical vein and inferior vena cava. Second is foramen ovale. Foramen ovale located is in the intraatrial septum. It provides blood flow from right atrium to left atrium. Third important shunt is ductus venosus. Ductus venosus provides the blood flow from pulmonary artery to aorta. And at the birth, after birth, infant takes a breath. Then oxygen enters the lung. Then pulmonary capillaries dilated, so it can lead to decreasing of pulmonary vascular resistance. Decreasing of resistance can lead to increasing of left atrial pressure. Left atrial pressure increases rather than right atrial pressure, so it can lead to closure of foramen ovale. Then it's called fossa ovalis. Increasing of oxygen content from respiration and decreasing of prostaglandins. Why decreases prostaglandin? Because from placenta secretes prostaglandins. Removing of placenta, no source for secretion of prostaglandins. It provides closures. They provide closure of ductus arteriosus. Ductus arteriosus closes, then no link between there is no link between a pulmonary artery and aorta, but we have some. If it cannot close, we have some drugs for closing. It's called NSAIDs, non-steroid anti-anginal drugs. Indomethacin, ibuprofen, or acetaminophen helps close the patent ductus arteriosus. Patent ductus arteriosus then gives rise ligamentum arteriosum. It's a remnant of ductus arteriosus. We have a mnemonics, indomethacin and PDA. PDA is a patent ductus arteriosus. Prostaglandins, especially E1 and E2, keeps PDA, patent ductus arteriosus, open. So we finished the fetal circulation. If this video is useful, please subscribe and share the video to their friends. Bye bye.